Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Judith Borger.
Hello, friends, and welcome to episode 96 of the Aesthetic Doctor Podcast. This is Dr. Borger, and today we are going to talk all about ketamine. Yes, ketamine, which is really one of the biggest and hottest and most talked about mental health breakthrough kind of treatments. And my guest today is nobody other than the amazing Dr. Furkan Shinaishin. She is a board-certified emergency physician, just like myself. So she too has over a decade of experience, probably close to 2 decades of experience with ketamine in both the ER and the mental health setting. She is a physician that has worked among some of Northern Virginia's most prestigious hospitals, and she is the founder of Lucid Ketamine and Wellness in Arlington, Virginia. Please join me as Dr. Shinaishin and I talk all about ketamine. Before we start, though, I need to put in a little disclaimer that everything that we're talking about is for informational purposes only. So please always consult with your own physician or with us if you want to become our patients. We'd love to have you. But what we discuss on this podcast is for informational purposes only and not meant to be medical advice specifically to you. So with that disclaimer out of the way, please join me in welcoming Dr. Shinaishin as we talk about the incredible mental health treatment that is ketamine. I am so excited to welcome you. Thank you, Dr. Shinaishin, for being here. So let's jump right in. Ketamine. You and I were both ketamine providers in the sense that we administer ketamine in our offices for a variety of conditions. For those of listeners that may have heard of ketamine but aren't really sure what it's good for, would you go into what kind of conditions ketamine can treat medically?
So ketamine is a very unique drug and it has a plethora of uses. It's used in surgical practices when you want to put a patient deeply into an anesthetic state where they're not aware of anything, they're not feeling anything. It can also be used at a little bit lower doses for what we call conscious sedation in the emergency department, where we want patients to have a little bit of awareness of what's going on, in the sense that if we rub their sternum or pinch their finger, they can wake up, they can be responsive. So these are the ways ketamine had been traditionally used. In the last several years, it started to be studied for different purposes and studied at much lower doses than what it has been previously used at. So in roughly 1/4 or so of the dose that we use it for what we call conscious sedation, it's now been shown to have significant positive effects on mental health, most specifically major depressive disorder, anxiety, post-traumatic stress disorder, OCD. And it also has some uses for some chronic pain conditions. Most of those pain conditions would fall under what's called neuropathic pain, things related to damage to nerves or the nervous system, such as fibromyalgia, chronic regional pain syndrome, some neuropathies such as chemotherapy-induced neuropathies, and some other ailments as well. So it's a really unique drug in that it has a broad spectrum of uses, all of which are determined by the specific dose that you are using it for.
Yeah, thank you for that thorough answer. And when you and I think what we should focus on for the next hour is really the mental health benefits of ketamine, because it's such a breakthrough, especially for some of these conditions, like you mentioned, PTSD, anxiety, depression, for those cases that are treatment resistant, right? And we have a lot of medicines and drugs that people can take by mouth, but there's really cases that are A, very resistant, and B, there is some serious and also bothersome side effects to these meds. So not everybody wants to take the meds, or even people that take the meds, there is actually quite a bit of treatment resistance to anxiety, depression, and also, especially PTSD. We don't have the greatest treatments for PTSD, and now like enter ketamine, right?
Yes, so actually, PTSD is where these benefits were first studied. These studies were done primarily on veterans who are the ones that have experienced probably the highest level of post-traumatic stress disorder that anybody could think of, being in war situations, killing, watching others be killed, etc. PTSD is actually where it was first discovered that it was making a strong impact. And then the animal research started to come into play. For example, one of the ways that they were able to determine that it truly is helping with depressions was in animal models, specifically mice. And one of the tests that they did, and specifically testing ketamine versus placebo, is in a type of study called a learned helplessness study. What learned helplessness means: so in these scenarios, you would take a mouse or a rat and you would drop it into a bucket of water. The mouse is going to try to climb out of that bucket. It's going to try and keep its head above water. And then eventually it's going to give up and it's going to sink. And then, of course, the researchers pull the animal out of the water. So that gives you kind of a baseline of what's the mental health condition of these mice at that time. So that's your baseline. What they did is they gave these rats and mice ketamine and then retested what their reaction would be. Again, threw them in the bucket of water, and now they noticed that these mice are putting up a much bigger fight for a much longer duration before giving up and letting themselves sink, and then of course being pulled out of the water. So this was a very important model which kind of led further studies, and both in the animal model and human model. But it really showed that even with a single dose of ketamine, people or animals' moods could be elevated such that they had more drive for survival, which is essentially what we're all looking for, is having that drive to survive each day, each week, each month. And when you're dealing with somebody who has severe depression, they mentally feel like these mice that are sinking and cannot keep their heads above water.
Yeah, I love that you quoted some of the research, because there is really so many studies in really big journals that have been done over several years that support how helpful ketamine can really be in these normally really kind of hard to treat conditions, and things that not only do we lose people, obviously, sadly, to suicide and self-harm, but it's also like this whole idea that I think everybody should be able to live a life that feels the best way possible. Because, of course, in my own practice, I have patients referred to me by practitioners that are really having thoughts of suicide, where they're treatment resistant, and I love treating them. But at exactly the same amount, I love treating people that might appear really functional, and to the outside, like everything might look great. And then on the inside, they're like, no, I'm having panic attacks every day. I have to give myself self-talk for my crushing anxiety, or I take a different detour to work because I have a PTSD stress response where X, Y, and Z happens. So I guess that's the one thing that I wanted to mention, is that really ketamine and this idea of feeling better, we all carry trauma, right? Most of us, and you and I, as like healthcare providers with over a decade, 2 decades, 3 decades combined of experience, We've witnessed a lot of horrific things. And I would really postulate that the more I've sat down with people and the more I've talked to people, even, and again, I live in an area where we have Fort Bragg, the world's biggest base. So there is a high rate of PTSD that's military related. But even if you're not military, like we all carry trauma, right?
I mean, we all carry trauma, and as a country and as a world, I think we've all had some degree of depression, especially since the pandemic started. The pandemic really brought out a lot of the mental health crises that we're seeing in this country. I mean, people were feeling very isolated, helpless,
Scared.
scared. And even though we've moved past that, I think the mental health implications have not disappeared just because the heavy pandemic disappeared. I think as a society, we're very down, we're very in the dumps about a lot of things that are happening in our country and in our world in general. And I think more and more people are looking for something that's going to help bring them out of that state. And like you mentioned, with the traditional antidepressants, for starters, up to 40% of people get no benefit whatsoever from the traditional medications. And of the roughly 60% that do, it comes at a heavy cost. Side effects are enormous. You hear people talk about constantly having dry mouth, or loss of libido, or even difficulty sleeping at night, or sweating at night, or tremors, or if you miss a dose, you get what's called a brain zap. I used to call them like little mini seizures. And why should we have to settle on something that's barely effective and comes with all these side effects when it seems we have something that is much better, and so far with not many or any significant long-term side effects. So I really think we're going to be moving, as the years come along, we're going to be moving more and more away from these traditional antidepressants and more towards more long-term, more effective treatments like ketamine therapy.
And you know what I love about ketamine, and you mentioned it, because it has such a wide range of implications, we know what ketamine does even at much, much higher doses than what we use it for in mental health treatment. And we really have like what, close to 50 years of experience with ketamine as a drug from when it was first used, what was it, in the early 70s or something. So I think like even though it is a relatively novel treatment for anxiety, depression, PTSD, ketamine by no means is a new drug. And especially those of us who have used it in sedation, anesthesia, and all those things have a lot of experience using ketamine and knowing its safety profile. So I think that's the point I really wanted to make, that a lot of people are always scared of new treatments, and rightfully so. But ketamine isn't a new treatment, and we really can dose it very precisely, and we know its safety profile really well.
You bring up an excellent point, because we all know what's been said in the media about ketamine. We all know what happened to Matthew Perry. Sadly, the emphasis in his death was 100% on ketamine. Now, you and I know as ER doctors, the doses that we use to put patients to sleep, we love using ketamine for that purpose because of its high safety profile. It's one of the only medications that is not suppressing respiratory drive when used at therapeutic doses, which means you almost never have to supplement with oxygen. You almost never have to assist with the breathing in any way, shape, or form in patients. It has a very high safety profile from a respiratory standpoint. And it is, in fact, and you work more pediatric shifts than I do, but it is, in fact, the preferred method of putting children to sleep because of its high safety profile. But of course, when the media gets hold of a story like what happened to Matthew Perry, and you see that here's a drug or medication that is being used recreationally, all of a sudden, the implication is that ketamine is a dangerous drug. What they failed to focus on in the case of Matthew Perry is the other co-ingestions that he had with the ketamine. There were opiates in his system, there were benzos in his system, and yes, there was ketamine in his system.
And I think alcohol too.
And probably alcohol. I don't even remember for sure. But really, it was all those other medications that are the respiratory depressants. It's very, I'm not going to say it's very difficult, but you really have to use a profoundly high dose of ketamine alone to induce respiratory suppression and subsequently death. And this is why it's our preferred method for sedation in the ER for both children and adults. And in fact, for the last 10, 15 years or so, even when we wanted something a little heavier for sedation, we'd supplement it with ketamine to help reduce the negative effects of that other drug, without compromising the level of sedation. So in the correct hands, in the hands of a physician or a ketamine provider, it is one of the safest medications that can be used, especially in the doses that we're using to treat mental health.
Yeah, I mean, I think you bring up excellent points here. And also, you and I, as ER doctors, we have seen even the best drugs get abused, right? And ketamine is a wonderful drug, but you go mix it with 6 other things and take it at crazy high doses and go party in your hot tub, like that's clearly not what we're doing, right? And that's also, though, in my podcast, I always talk about how people that seek certain treatments, this is not the time to go for the cheapest treatment or the unlicensed treatment, right? When your body, when your health, when your wellness is concerned, that is when you seek out the reputable person. You make sure they have a license. You go to a physician or a mid-level that's properly supervised or practicing within the limits of their license. And you go to the best, safest place you can go to get the highest quality of treatment. And I don't know what your practice is, but I have all my patients on a pulse oximeter. We take their vital signs before, we take a good history, and then again, they have me. This was going to be one of my last questions, but seeing that this was the arc of our conversation, I think you and I both having 15 years of experience using ketamine in the ER, we kind of make the perfect ketamine providers because we have thousands and thousands of patients that we have monitored, and you are in really, really good hands with somebody that has a background like ours.
I always tell patients, look, it's an incredibly safe medication. I have no concerns about using it, but in the 1 in 1,000 or 1 in 10,000 chance that something bad is going to happen with the administration of ketamine, I have intubation supplies. I know how to get your airway protected. I know how to maintain you in a stable position until, further help gets there. And these are some of the things that are very important when you see a lot of these kind of boutique ketamine clinics opening up that may be run by other providers that don't have the same experience using ketamine as ER doctors or anesthesiologists. You always run that risk. And yes, we talk about how safe ketamine is, but nothing is 100%. And you want to be with that person that if something happens out of the norm, is this person the one that's going to best be able to manage that? And that's what I tell my patients. Yes, we're monitoring your vital signs. We're making sure you're not getting over sedated. But what's most important is that I have my eyes on the patient every 2-3 minutes. I'm popping my head in the room, just checking on them, because that's truly what is going to create the safest experience, is having an experienced doctor constantly at your bedside checking in on you.
So going back to ketamine, We've talked about how incredibly well it works. What are some of the reasons in the brain that it works? What does it do in the brain to work so well for what it does?
Okay, so I won't get into too much of the esoteric descriptions of the biochemistry behind it, but in a broader sense, what makes ketamine unique is that the effects are, what's the best word I should use? Like multifold. So you have effects that happen immediately, like the very depressed, near suicidal patient that comes in within 15 minutes of getting their ketamine dose, no thoughts of suicide. They're happy, they feel great. Oh my gosh, I can't believe how well this worked. They go home, they're going to feel good for a couple days. Okay. Then, after 2, 3 days or whenever they're scheduled for their next treatment, that same thing's going to happen again. Maybe you're going to get a little bit more prolonged effect, and so on and so forth. This is going to keep happening until you get towards the end of the induction series, which is 6 sessions. Once you get to that 6th session, that's about where you start to see what's called neuroplasticity happening. And what neuroplasticity means is the connections in the brain, the wiring in the brain is actually going to start to adjust and rewire itself. And it's this rewiring that's going to actually give the more prolonged benefits of the ketamine that is what makes it so unique as far as a mental health treatment. So, what that means is after your 6th induction session, many patients will be able to go weeks, if not months, without having any depressive symptoms. And that's again without any more doses of ketamine and oftentimes off of their other antidepressants. So, this is what makes it a very unique medication. With everything else like Zoloft, Prozac, Celexa, Effexor, all of those, within days of stopping that medication, your brain is going to return to right back the way it was before you started taking those medications. The neurotransmitter levels are going to readjust to their baselines. Those number of receptors are going to readjust to their baseline, and it's going to be like you had never taken that medication at all. Ketamine, on the other hand, as time goes on, the benefits and the effects are going to be long term. And as I said, you may go weeks, you may go months without having any symptoms. Most people will end up needing booster doses at some point, and that's very individualized. Again, some people may go months without needing a booster. Some people may need a booster once every 3, 4 weeks. But for them, that's worth it compared to the effects or lack of effects of traditional antidepressants and having to take a pill every single day and deal with those side effects.
So we went a little bit into who is a good candidate for ketamine. And to recap, it's really PTSD, anxiety, depression, certain chronic pain conditions, mainly. What are some of the things that, and again, we're all doing individual intake, but just broadly, what are some of the things that disqualify somebody or that would make them not a good candidate for ketamine treatment?
That would disqualify a patient, for one, is if they have very poorly controlled blood pressure. If their blood pressure tends to be on the very high side, we have to be careful because ketamine can raise the blood pressure. And that's why we want to do frequent blood pressure checks throughout the therapy, definitely at the beginning, definitely at the end, and at least once during the middle of the therapy. So, other things that would disqualify a patient from being a candidate for ketamine therapy, one is a strong, for me personally, a history of substance abuse. While ketamine is not physiologically addictive, it doesn't trigger those reward pathways like opiates do, like nicotine does, etc. It does when people use it even at therapeutic doses. You do feel good. Most people walk out, they love the way they feel, they have an elevated mood, there's a pep in their step. And that feeling can be addictive. People can say, I want to feel this over and over again. So again, physiologically, it's not creating any addictive signaling in the brain. However, people enjoy that feeling. And if you have an addictive personality or somebody who's had a substance abuse history in general, I don't want to encourage these kinds of patients to seek ketamine therapy, because what's going to happen is they may, after their therapy is done and they've done the 6 inductions, they may miss having that feeling and they may seek out other means to acquire ketamine. So that's a very important part of my history taking, is if there's any history of substance abuse. So we mentioned the blood pressure, we mentioned substance abuse. If you have a history of schizophrenia, that's one that you also need to be very careful with, because it can, in patients with predisposition to schizophrenia, schizoaffective disorder, it can induce hallucinations and even psychotic episodes. So those patients, that has to be, a decision has to be made between the patient and the psychiatrist, and risk benefit has to be weighed. But in general, I will defer patients with schizophrenia to other ketamine treatment centers that likely have psychiatrists on staff.
Yeah, I mean, I think it's very interesting what you say about addiction, because I will treat patients with a history of addiction as long as they're not actively in addiction, again, with very clear counseling of that they might like the feeling, even if ketamine is not addictive or their drug of choice. And I've actually had very, very good results. But yes, I will absolutely in my clinic not treat anybody with schizophrenia or any history of psychosis either. The other thing that I was going to quickly have us talk about, because you mentioned psychiatrists, is there is a really important piece of research in terms of how important concurrent therapy and integration with ketamine are. So, especially if I have patients that really have clinically significant PTSD, anxiety, depression, I do personally require them to be under the care of a counselor, because we know that ketamine, with the proper integration and the proper processing, really, the results are so much more off the charts even than ketamine alone. What's your thought on that?
Absolutely. My patients, ketamine is not the treatment plan. Ketamine is part of the treatment plan. And all of my patients have to have a psychologist or a psychiatrist that is involved in their care. They have to be aware that they're getting ketamine therapy. It's a collaborative effort, and I make sure that the patients are receiving therapy at least within 2 days of getting a treatment, because you know, when you get that ketamine, all of a sudden, all these things that you may have had bottled up in the back of your mind, it's now like percolating and surfacing to the top, and it's a lot to unpack. I'll sometimes have patients that just during their therapy, they're getting very tearful and crying, and they're telling me they feel so vulnerable, and like just everything is kind of just coming out into the open. And this is exactly the time that you need to have a therapist to help you unpack these feelings.
And we also know that sort of ketamine, like you said, for those 2, 3 days, like opens this therapeutic window. And when I talk to my collaborating psychiatrists, counselors, psychologists, they do say that in those 2, 3 days after ketamine treatment, that therapy session sometimes moves them forward. What a year without ketamine has not moved the patient forward. So it's also the fact that the synergy of the two. And there's actually really good literature out that there's, I think, about 10% difference in effectiveness with and without therapy. And so I guess I wanted to make sure that if people listen to this, that they know that the best treatment is really that synergistic combination of ketamine as another tool in your sort of already existing mental health journey with your mental health professionals.
Absolutely. It is I'm not going to say miraculous drug, because I don't think anything is a miracle drug, but it is a unique and astonishingly good drug. But again, it's not the treatment plan, it is a part of the treatment plan. And part of that treatment plan, even beyond just the medication and therapy, it's self-care, it's exercise, it's eating well, having good mental health is it's all connected. You have to have good physical health. You have to be
Sleep
in
and
good
rest too,
surroundings.
so important.
The
Sleep
what?
and rest, especially after your treatments, letting your brain kind of do its thing.
Actually, you brought up a good point. Even patients that don't particularly come in complaining of insomnia or any sleep issues, they have all told me, wow, Dr. Shinaishin, I can't believe how well I'm sleeping after these therapies. I said, well, I didn't know you were having any sleep trouble. They're like, I wasn't per se, but now that I see by comparison, I'm sleeping so much better. And that rest and that restorative sleep, that is also a big player in helping the brain rewire and get those neurotransmitters to the levels that they need to be for a healthy mind.
One more question about things that work really well synergistically. What do you do for music or sound during your treatment? Because there's a lot of research also in the importance of sound and music and certain frequencies with ketamine treatments.
Well, interesting question. So I actually typically let patients, I ask them, do you have a certain type of music that brings you calm, that brings you peace, no matter what the circumstances, that you listen to this and you feel better? If they say yes, then I say, okay, let's bring that music. They already know what works for them, what brings them a sense of calm. For the patients that don't have that, or they're a little unsure of what kind of music would be good, I have a playlist. Actually have a few different playlists, and one of them involves, I don't know if you've heard of binaural beats.
Yes, yes.
Okay. So binaural beats are different frequencies coming in to from one ear and the other ear. And then when they combine, it creates a frequency that normally can't be recognized independently in the ear and in the brain. But in this combined frequency, it's a unique frequency that once the brain detects it, it tries to mimic it. So there's different binaural beats for different types of situations, anxiety, pain, sadness, whatnot. So you can incorporate these binaural beats into calming music, which is very effective. So I have that for patients that are willing to try it. Other patients are, and this is one thing I had to get used to, is patients can be very particular in their needs. A lot of the patients who are coming in with depression, they may also have OCD and whatnot, and like things have to be done a particular way for them, and they're a little bit less flexible. So I see which patients are open to it, and if they're willing to try my playlist, I use binaural beats or some other just very soothing kind of euphoric music. And then otherwise I let patients just listen to what they prefer, whether it's classical music or Enya or Yanni or something like that. Whatever makes you feel good is what's important.
Yeah, there is. I always found it fascinating, though, that there is also, we know that music elevates our mood, and we know that music kind of suppresses us, not suppresses us, but that music like takes us into a certain state. And I thought it was so interesting that there is really science out there and research about how certain frequencies and how certain types of music, you mentioned binaural beats, there's obviously other frequencies out there that can really, like, again, synergistically help the ketamine, just like you said, by bringing people into that happy, relaxed kind of certain mind state where they're also open to the healing and the experience and all the things. Well, thank you so much. This has been such a blast. The one thing I would love to ask you is, like, how did you get into performing ketamine treatments? And if it's too personal of a question, you don't have to answer it, but I'm just so curious what
No,
led
not
you
at
to this
all.
path.
I actually first thought about opening a clinic in 2020, and then of course the pandemic happened, and that whole idea got put on hold for a few years, and then my dad passed away, and so just like a lot of things that were kind of preventing me from being able to pull the trigger. But I've been really interested in it for a while. And I even started using ketamine in the ER on patients that I was not sedating, but patients that I was seeing coming in very frequently for certain chronic conditions like intractable migraines or cyclical vomiting syndrome or bad fibromyalgia. And I remember like at least every couple days I'd get a call from the pharmacist. Why are you ordering ketamine on this patient? And that's not the dose we use. And I'm like, well, just bear with me. I'm using it for a different purpose. And so I started to even just use it on some of our frequent flyer patients with chronic conditions and started to notice them coming in less and less and less. And when they came in, they're no longer asking for morphine. They're no longer asking for Dilaudid. They're no longer asking for benzos. Just this one dose of ketamine is helping them, and it's keeping them able to manage their symptoms at home, oftentimes for several weeks before they would come back. So I was kind of doing a little bit of my own studies over the last few years because I heard what the research was showing, and it really just strengthened my interest in it and my desire to open up a ketamine clinic, because especially when it comes to mental health, having to be in the ER during a mental health crisis is one of the worst places you can be. You're anxious, or you're feeling suicidal, you're ending up in this chaotic environment where your phone is taken away, your clothes are taken away, you're not able to have any visitors. It's almost like you're in this state of being punished for what's going on in your own mind. And it really made me think that we as a medical community, and I'm not blaming psychiatrists or primary care doctors, but we're not effectively taking care of our mental health population. And it's in part because we didn't have great medications to do the job. So I really am looking forward to ketamine becoming taken away from that off-label status on FDA and it becoming more of a mainstream therapy, because I really think it's going to keep patients out of the ER. It's going to keep patients from being in this crisis state. And hopefully patients are just going to overall be better able to manage their condition at home without having to set foot into a hospital.
Yeah, thank you. And I completely agree. I think if for all of those of us who were especially frontline providers during a pandemic, I think after that pandemic, there was no way to deny that as a country and as a society, we're in a mental health crisis. And so I completely applaud you for taking this and turning it into something of such healing and benefit to your patients. So thank you for doing that. As we talk about your patients, if you've been listening and you're in the Northern Virginia area, why don't you tell us where your practice is, how people can find you, how they can connect with you, and all of the things?
Thank you. So my practice is located in Arlington, Virginia, in town of Roslyn. So we're just footsteps from Georgetown. It's a very nice location. My practice is at 1550 Wilson Boulevard, Suite 650, Arlington, Virginia 22209. Our Instagram page is lucid_ketamine. And my practice name is Lucid Ketamine and Wellness. And you can find it on the web at lucidketaminewellness.com and on Facebook, Lucid Ketamine and Wellness. So I take same-day consultations. Consultations are free because a consultation is an essential part of determining whether someone is a good candidate for ketamine therapy. So that is at no cost. And I work really hard to accommodate people's different schedules. I'll come in late at night if needed, early in the morning. So I'm really trying to do my best to be flexible and accommodate patients with all sorts of different needs and schedules, etc.
Well, thank you again for everybody who's driving. Don't stop to follow her right now. We're going to link everything in the show notes so that all of Dr. Shinaishin's information is going to be in the show notes for you. Again, thank you so much for being here. Thank you for what you do, and thank you for helping educate people about ketamine.
Thinking of me to have on your show. I really appreciate it. And I've enjoyed watching your progress since you've opened your practice, and kind of you're a bit of an inspiration to me to actually get this going. So thank you for that.
Oh, thank you. And I absolutely love performing the service just because of what it does for patients, right? Because in the end, it's all about the patients and the outcome. And ketamine is one of my favorite services that I offer, and I offer a lot of them simply because of the just like profound, profound impact on somebody's well-being that it can have.
Absolutely. Absolutely. And I think we're going to see a lot more of it. And I think it's going to be very commonplace in the near future for mental health treatment.
Well, thank you everybody for listening, and we will see you at the next episode. And thank you again, Dr. Shinaishin.
You, Judith, Dr. Borger. I appreciate you having me on your show.
Thank you for listening to the Aesthetic Doctor podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger, and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.